One of the biggest medical mysteries doctors are still trying to figure out, that inflammatory disease some children get when they contract COVID-19. It's important to note that this is not present in every child that tests positive. It's very rare, in fact. Kayla Green talked to a clinical director about a case of the strange disease this week right here in our area.
While doctors say multisystem inflammatory syndrome in children isn't common, they also say there's symptoms parents should look for and get their children checked if they see them. Krissa Charno is the clinical director at Acute Kids Pediatric Urgent Care. She says MISC is a diagnosis of exclusion, meaning everything else is ruled out first.
Where they present with injected eyes, kind of looks like a pink eye to a parent, febrile illness, they're usually pretty sick. So that's Kawasaki's syndrome. When you run the normal laboratory evaluation for Kawasaki's, that was all negative.
Charno says these unusual labs have increased since the pandemic started.
We think that because we've seen the increase in cases, it might be correlated to coronavirus infection. But again, not every child that presents with this is positive for COVID. Some of these kids test positive for either active disease or antibodies, and some kids test negative for both.
Charno says she treated a child this week that had a rash and was sick.
We sent him to the hospital. He was evaluated by the team. These special labs were ordered, and he ended up having significant abnormalities, which would push the team more towards a diagnosis of MISC. We have no idea how to tell whether one child is going to get very sick or one child is not. Some of these kids that are admitted to the hospital, require ICU care, like the child that we saw. He's doing well, by the way.
Charno also says it's important, if you see any of these symptoms in your children, to bring them to a pediatric urgent care where they'll be familiar with this disease. In Webster, Kayla Green, News 8.